Yeah, thank you very much.
All right. So, can you introduce yourself to our viewers?
All right, my name is Usayende Friday. I'm the state coordinator, persons living with HIV and AIDS in Nigeria at the Edo State chapter.
Thank you very much, sir. So, you have a very interesting story.
Yes, thank you. Actually, living with HIV and living with HIV is, though it's not a death sentence, and I've been living with the virus for so many years now, for like since 2003. And when I was disclosed of my status, initially it was not easy for me to deal with, but as time went on with counseling, support from friends, people that are already living with the virus as at that time too, and of course, health workers, I think I'm able to stand back on my feet. How is it?
Wow, that is so touching, I must say. At what point did you find out you were HIV positive?
We see these days we encourage people to go to facility for compulsory testing or voluntary testing.
Exactly.
But in my own case, I didn't know until I was first sick year back, and after consistent.
So how many years ago were you looking at?
Since 2003. It's long.
Oh, man. that's a very long time.
It's long. So when I first sick, I went to treat malaria in the hospital, and I went back again and again. I was like,
this is getting me scared, and I'm beginning to sweat because almost every other person, when they are sick, they think it's malaria, and then they just dash to the medicine shop and then they treat malaria.
Like, seriously.
So you treated malaria, and then what next?
Yes. The then doctor, the medical director of Oben Cottage Hospital in one of the facilities in Orion.
Okay.
Dr. John, who is now, of course, in the Central Hospital, now said, look, maybe we'll go back to screen for SYZ. And by the time he did the screening and came back to broke the news to me, it was not easy for me to deal with.
Just give me a minute. Let me check.
It was not really easy for me to deal with. And thank God today, he has been of great support too.
Wow.
He did not just leave me at that level, disclosing my testing and disclosing the status to me, but also he supported me a lot. That is it.
So let's look at when you now got to know your status. The test was done. How did you receive the result? And how did your family also deal with the news? Because I'm sure as at 2003, the amount of knowledge and the exposure we have now about the virus, that is not a death sentence, that it can be managed and people can still live a normal life, and all of the conversations around that, as at 2003, I believe was not there. This was a time where an average person believes that once you are diagnosed with HIV, that's literally like a death sentence. So how did you take it, and how did your family also deal with it?
I can say it was devastating. Being the breadwinner of a family, and I lived in a very small community. Information moves.
Everybody knows fast. Everybody.
So that is it. And besides, I've been I was a popular, and I still remain popular within my community members. Everybody knows me, and this information, when it came up, however, I did not go ahead to disclose it to my other persons.
Okay.
Though I did that to my family, but there are some facility staffs that have access to that information as at the time the screening was done, and they let the cat out of the bag.
But that was very unprofessional. But did you think of perhaps suing them or doing something legally as a way of seeking redress?
Knowing your rights.
Yes.
If you know your rights, and once it's trampled upon, then you know what to do.
Okay.
I didn't even know my right then.
Exactly.
What I was already battling with is, how did this happen? Asking myself certain questions: from where? How did it happen? What did you do?
Again, dealing with that fear too.
I will soon die,
Yes, exactly. Yeah, that was expected.
But that
has
been the case then. Even people before me, I saw people before me, either on television or I read on the paper, that they will just lock them somewhere. So my mind was like reading through so many stories.
Exactly, a lot of negative stories.
And I was just waiting for what will happen. Coming back to my family, my wife was really supportive.
Oh, you were already married at that time?
Yes.
Wow.
She was really supportive. And I drew her attention to, if you don't know, I lost a wife. My first wife, I lost her.
So the virus?
Yes.
Okay.
And I had to remarry. And when she heard of this, she said, well, there's nothing.
Did you have any children at that time?
She left with two. She had 2 boys for me.
And are they clean?
They are negative. They are fine.
And you do not know. You did not know that.
The 2 of us didn't know.
And yet the children are clean, and she breastfed. She did every other thing.
We did everything. It's when she was sick, and took her to the hospital, and I was down with malaria too. Though when she died, however, to other opportunistic infection. In this
Exactly.
case,
So how on degenerated to AIDS?
yes,
Oh,
already. So now I started managing malaria from time to time. It was then the doctor draw my attention to screening for HIV and other related illnesses. So that is it.
now let's now look at away from the diagnosis, you losing a wife, and then how were you able to come back to your current state? Because I can see that you're obviously doing well, and I met your wife earlier today, and you people are a very one big happy family. So how were you able to leave that zone to come into your normal life?
I am sensitizing the public today because I got little of sensitization from persons that already had that capacity to disclose to me that, look, this is not a death sentence. You can live your normal life with the virus. And of course, my doctor and every other close associate.
Okay.
That is it. So today, I don't see it a challenge. People say it's a I hate when somebody call me patient. I'm not a patient. I'm only experiencing challenge. Everybody out there has his own challenge.
Exactly.
So for the fact that I'm living with HIV doesn't mean
you should be regarded as.
Come on. So that is it. I'm very happy. At least I know my status and I know how to manage myself. And we are praying that those that are out there that don't even know their status, first point to fighting this challenge is knowing your status. If you don't know, you know what to do.
But that is very difficult in our world now. People would, I know of some people, we have had this conversation, although privately, the people would tell you that they prefer to probably just die out of ignorance, not knowing their status, that for them to get to know that they are living with this virus, and for them it makes their life miserable and they might not be able to get that quality of life again. How do you see this?
What I think there is that there was no proper process to screening them.
Okay.
What I mean is, that's what we call counseling. You should have before screening any person, take him or her through a counseling session. During this session, the person there will be informed of the fact that if you are down, if at the end of the day you find out that you are reactive with the virus, fine, we will still go and do a confirmatory test. And if at that point too, is you are still positive, there's one thing that is sure: always reassure them of confidentiality.
Okay.
Because if there is confidentiality, your information is kept safe from you. It's between you now and the caregiver.
Yeah.
And in that case, so while some would prefer to maybe want to die, not knowing that, or they prefer to remain and whatever happens, happens.
Yeah.
I will not support that because they were not properly counseled. If they have the best of counseling, they will submit themselves to testing. Yeah. And the funny thing about it, if along the line you are trying to counsel and the person is prepared and something just came out and say, look, I'm no longer interested, the law permits that leave him at that point.
Seriously?
Visit him again from that. I'm trying to reassure the person that everything will be fine. And that is it.
All right. So clinically now, let's look at this virus. How does it work? And how do people get infected in the first place?
Before now, the virus is a disease of, we will say, people that live reckless lifestyle.
Exactly.
If you don't,
people who are not morally upright.
You're not morally upright. You are very careless.
Exactly. Sleeping around.
If you don't, let me, for the purpose of this discussion, use the word "megbeswegbe."
Okay. I'm sure our viewers will understand what that means.
So having megbeswegbe with so many partners without using protective in quote. That is one of the major.
But I would like to ask, did you have like such kind of lifestyle before you being diagnosed?
Before I was married, I have to be sincere, I had more than one friend.
Okay.
But those persons now, they are negative.
Okay.
As we speak today.
Oh.
So that is that. Coming to the area of how the mode of infection, we have like I've said, true megbeswegbe with an infected person without using protective. That's the condom in this case.
Okay.
And of course, we are using the condom, use it well.
Okay.
That is one. There are other ways when somebody is down and the doctor requests a blood transfusion. Please, we should always encourage that blood that is about to be transfused should be screened properly. Not for only HIV, there are other
hepatitis and a host of others.
That is true. The use of unsterilized sharp objects. In this case, it can be needle, It can be razor blade.
Okay.
Because you are not sure of who used it, please, me, I will advise.
Then hair clippers as well, and then sewing needles.
By extension, yes, they are sharp objects.
Exactly.
And that is that. And you know, most of these are brothers that does cleaning for us.
Oh yeah, this nail cutting.
Well, it's a trade. If you don't want to patronize them, you are putting somebody out of
business.
Out of business. But I will
and
advocate,
denying them a means of livelihood.
I will advocate, if you must use that, get you a sterilizer, say jig or hypo. Those are the only substances that I think.
It can actually kill it.
Yeah, for now.
Okay.
Then finally,
but we also see them put lighter. Does lighter kill it?
No. There are amount of heat that can kill that virus.
But that lighter heat is not sufficient.
No. To me, I will not subscribe to that.
Okay.
If you want to sterilize, there are processes of
sterilization.
If you are boiling the heat there, you just want to attain that number 80 degree, 100 degree or whatever.
Okay.
But that is not enough.
Okay.
Me, I will not support that. Or better say you have your own tool.
Personal clipper, and then yeah.
So that is and finally there is this that's what we call PMTCT.
Okay.
It's a prevention of mother. You see, when a mother is pregnant, whether she knows or not, and that child is born without she going through the normal treatment pattern, without she being enrolled for PMTCT clinic, that's prevention of mother to child transmission. There is that possibility that when that child is born, child might be born with the virus. How? During delivery or through
breastfeeding.
But today, thank God for science, a woman can be pregnant and delivered of a baby, and that baby will come out clean, negative, especially when she went through the PMTCT
during the pregnancy.
Cascade, yes, because she will be placed on regimen like every other pregnant woman. But there is a particular medication she will be placed on, and when she delivers of that baby, within 72 hours, that child too should be given drops of nevirapine.
Okay.
And that does the magic.
Wow.
Yeah. And again, gone are those days in the initial stage, we say we don't breastfeed children, but today we breastfeed.
Exactly. A lot of international agencies are now preaching exclusive breastfeeding now.
For 6 months.
Exactly.
And that is it.
Yeah.
That is so. If you can avoid this communication, this transmission channel, I think you are good to go. Okay. But it's not easy considering the environment we are and our lifestyle. No, it's not easy for you to. You just pray one and do your best. But if you are exposed by chance, either because of the nature of job you do or your lifestyle, please just run to any government facility for
support.
For support, yeah.
Okay. So let's talk about what you do, because I also know that you are advocating. You are advocating for people who are living with this virus. You are doing your best to also sensitize the general public about the dangers of this virus and how to stay away from being infected, because that's actively what you do. It's not just about caring for those that have the virus, but you are also trying to preach that message of, abstain and do the best possible to stay out of it. Can you share some of the highlights of the work that you do with us?
Okay. Before now, there is a survey conducted by NICE, Nigeria AIDS Indicator Survey, 2018. Impact survey, so to speak, 2018. It's an internationally funded survey research to know the amount of persons that lives with the virus in Nigeria.
Okay.
The age margin, the sex, so many indicators we are considered.
Okay.
And in that survey, Edo State was pegged at 1.90%.
Okay.
1.9% prevalence rate. That's what I mean.
Wow.
Yeah. Though we have other states that are lower, some states are 2 as a case, but
so on the ranking, what level does it put us?
It means, say for example, every 10 persons, 1 person.
Oh, that's huge.
So, having known that, Global Fund has really done a lot to support persons living with HIV and other opportunistic infections in the area of screening, treatment, provision of ARVs and other consumables.
Okay.
And of course, and general management of persons living with HIV in Nigeria. Those states not left around. And there is different projects that normally come through, we are a sub-recipient to Global Fund today, network itself. And there are projects we normally get ourselves engaged with to some states. Like as it is now in every state, the entry projects in every state of Nigeria now, we work with them. And my only way to contribute my quota to Edo State government and of course Nigeria is to share this knowledge and reassure our persons that you can live positively with the virus. There are so many out there. You don't go out, I go out. I know what, if you go to a government facility and some accredited private clinic where this treatment can be done, you find the huge number of persons that are living with, that we know that are in case. And there are more than that number that are out there going by that survey.
Who do not even know their status.
They don't know their status. And we are doing all we can to ensure that with the help of the state governor, to ensure that people that are out there are sensitized on doing their being screened and of course linked to any of these facilities. So what I do is to ensure that more people have access to this information. That story surrounding it, that is a death sentence, is that we want to erase that out. Yes, I live with the virus, and if you know me closely, you know that you can't tell if I didn't tell you.
Honestly, because you don't look it.
So my family and I, we are doing fine.
And your children are clean.
I have grandchildren.
Your current wife is clean.
Fine.
Wow.
Yeah, we do it just fine. And you can live positively with this virus. If you use your ARV, however, they are all free, all the services. If you use it consistently for like between 3 and 6 months, you will get to a point, depending on your body, you get to a point, you'll be virally suppressed. That means the amount of virus will reduce. And when that happens, you can't infect anybody.
But does that mean that if that person does a test within that period of time, is it going to be positive or negative?
Possibly it might not display. That's why during that science, there's what we call U to U, a terminology used as U equals equal to U. The first U here means you become undetectable. And the second U means you become untransmissible. That's why you find some persons, you say that they are a discordant couple, which means one of them has this virus and the other one don't have. Maybe the one that has the virus has been using his or her own medications before he met his partner. And they will live for life without the partner getting
infected.
Just take your medication continuously.
And that's it.
That's the magic.
Yeah. So this will now lead me to ask this question. Nigeria is a very religious nation. How much impact do you think that our religion across board, Islam, Christianity, and all other religions in Nigeria, how much contribution do you think religion has made in helping to reduce, or on the flip side, increase the prevalence of HIV virus?
Let's get one thing clear. Religion cannot stop the spread of the virus directly. Cannot, because you are religious, you will not get the virus. It's not a spiritual thing. Most people then they will say it's a spiritual problem. There's no spirituality.
So religion has no role to play.
It does have a role, and some of the role they can play is to help spread the news. The bulk of their flocks are young persons, and these diseases move among young persons, say between the ages of between 18 and 40. Let me peg it at that. And you go to either the church, to the mosque, you find these age categories there. So they can do a lot to help sensitize our persons there, sensitize everybody on the need, and open with the window for us to periodically visit either their churches, although taking permission from the state head, visit the mosque, even traditional institutions. There are some, I visited some traditional institutions, some which I know popular native doctors in the state today. I introduced to an extent a system where using one razor blade then, like our people,
because those traditional practices of making those incisions, that is
they
true.
Must use it. Everybody should have his own razor.
Do you know that I did not even think in that direction?
For example, you can further divide one razor blade to 3, 4 as the case may be.
Yes, and just use a bit to do what you need to do. But it did not
stop there, because the same hand with which you use in rubbing Mr. Peters'
medication,
you use the same hand again rubbing Peters. So that brings us to where we need to bring in.
This is your advocacy work is serious.
Yes, bring in, say, jig to always wash hand. But however, coming to the bigger religions like the Christian and the Muslim religion, they will do a lot to really support us.
This. So a follow-up to that traditional practice of making incision and all those things, how easy was the reception? Because most of those people are not very educated, so they probably do not understand the science behind what you are saying. Then applying jig and all those precautionary measure. How easy was it for them to receive this
Yes,
practice?
initially it was not easy because they will tell you that, look, this we'll be doing over the years.
Exactly, and we have been getting results,
and
good results.
We'll be getting results, but with consistent training. Do you know, I mix up with them a lot. I've been a village boy.
Okay.
So I mix up with them a lot, and as I visit all the facilities in Edo State to see how service delivery are going on there. And I have opportunity to meet some persons in that, in quote, traditional religion in the facility, coming for care. At a point, some might be shying away. I'll just move to them. Look, relax, we are together. I've known a lot of persons that have died, popular people that have died from this virus, either in Christian, in Muslim, or African traditional religion. So that's why I say religion cannot stop you from being infected. Just do your best and do the right thing. And the right thing is to do everything that will make you be exposed to the virus. You stay clear.
Now, still on religion, how robust has the support been from the religious bodies themselves? Because you might not necessarily be part of them as per being a traditionalist, a Christian, or a Muslim. How robust has the support been from their end?
They'll be supportive. There are projects normally there are projects we normally handle in the state, and part of the participants are religious leaders.
Okay.
We'll go to them and we draw their attention to these trainees, this program. We speak to them, and in turn, they'll go back and cascade whatever we've discussed in the training to their floors.
Okay.
It's really it's moving well.
So they've been a huge support from their end.
They are giving us all the support we need.
Okay. That's good to know. Then this will also now drive me to marriages, right? Sometimes in certain religious groups or organizations, specific attention is not paid to having intending couples undergo screening for things like HIV and other associated viruses and diseases before joining them together. Do you think this factor has also further predisposed a lot of people to getting infected with HIV?
Everybody has his own reasons for whatever he or she says. And for me, I don't think it is right for any religious institution to stop marriages between two or more persons on the ground of health.
Okay.
If they choose to live as one, for God's sake, leave them to live as one.
What if they are attending risk?
Risk as to, for example, in the case of HIV.
HIV, and it could be any other medical condition.
To me, I think there shouldn't be any interference. They know themselves and they know that's their status. For example, apart from HIV, if they have any other health conditions and they've agreed to move on, I think it will be even better for them to manage themselves.
Since they have this prior knowledge of their status.
That prior knowledge. For example, one between or among the parties knows that the other one is living, and they still insist. Then it will be easy for them to manage themselves. Because in our case, when anybody is screened for HIV and the person is enrolled, is linked to care, the next step of contact is your partner, your spouse.
Okay.
You bring your spouse, we screen your spouse as well. If the person is maybe, as it can be, is negative, no problem. Because before doing all this, there is this extensive pre and post counseling session that will bring the person to the reality.
But are these counseling sessions available in some of the religious groups and bodies you have worked with? Well, whether being Islam, Christianity, or any other kind of religion?
I've worked with some denominations of Christian, Christendom, and they are very receptive. Their doors are very open for us.
How about on the part of Muslims and Islam?
A few times I've visited mosques, though we've not had this opportunity to say, okay, let's go out for a screening and we'll bring our people. Me as an individual, but I believe my predecessor did a lot of that session. But the overall goal is that to ensure that all our persons are sensitized and the religion that will be of great support to us.
Okay. Yeah. So coming back to your own establishment now, obviously you have access to a lot of people who are living with the virus.
Yes.
Currently, what would you say the quality of life is for them? Quality of life, I mean, health-wise. Again, quality of life, I mean, means of livelihood. How are they thriving?
Okay. Let me caution something. So many persons are watching this video and they may have different interpretations. But just let me tell you that don't use me as an individual you are seeing here to assess every other person that lives with this virus.
Okay.
If I have all it needs, all it takes to look this good, not everybody out there have that opportunity. Our persons, they are poor. The virus has made them to, like, this self-stigma is already there. Forget the stigma out there. Within there is this self-stigma. And that will not make them want to work. Even the few that are able to say, okay, make up their mind, let me take life the way it is, I want to work. Majority of them are deprived meaningful employment because of their HIV.
Because of their HIV status.
Again and again. And again, there are so many people out there too that would have said, okay, let me start up a business. Because somebody somewhere else knows their status. For example, a woman that cooks. Before you know, somebody else will just go and tell one or two customers, look, this woman lives with her.
That can potentially kill that
but
business.
All this we've just indicated has nothing to do with you being infected, either as a staff, a co-staff, or as a customer to that woman. Because it's not a disease that just fly from one place to the other, or it's a spiritual, like I say. It's when you are exposed to either body fluid or blood. For example, somebody that went to eat, that food was cooked for God's sake. And during the cooking process, if at all, in quote, she injected HIV into it, that it can't survive. The following thing, scientists have told us that when this blood is put on surface, before it reaches 1 minute, it has died. The virus will die.
1 minute.
It might be even up to that. It will die. That's why I personally have come out and I have spoken with some of my colleagues in the 18 local government, my support group coordinator. See, we need to sensitize our people because there's not enough awareness creation on the part of the government. If there is enough awareness creation and everybody are aware of, oh, this thing cannot just somebody cannot just get infected easily. I see no reason why somebody that says trying to earn a living from, maybe she cooks and sells for other person.
Exactly.
People will run away from her.
Or works in an office
somebody
environment.
wants to work. So it's another opportunity for our people to know their right. And because of this continuous complaint, we cry to the state government, we cry to the federal government, and all over this country that this supportive document to back us. It's called Anti-Stigma and Discrimination Act.
Okay.
2014 in our case. So that is a document that if you stigmatizes any of our person,
the individual or the
as an individual or as a group,
they can be charged to court and prosecuted for that. Seriously.
And with that too, it has really empowered our people. So it's really giving our people the assurance that yes, you can still mix up with people.
Okay.
If that is, I'm even looking for somebody to stigmatize me now. Stigmatize me, and you wait for the
repercussions.
repercussion.
Yeah.
So that is it. That is not the case, though. I know you will not do that.
Yeah.
But help us share this message. Tell our people that living with HIV is not a death sentence, and it's like every other disease burden out there. It will even better. Sorry, it's not because I'm already living with the virus. That's why I would say I prefer and pass cancer. But people that live with high blood pressure, people whose glucose level are high,
exactly,
they suffer much more than we
HIV patients.
I can eat anything I want to eat. I didn't be in I have a strong teeth to eat stone. I will eat. I can wear anything I want to wear. I can sleep anywhere I want to sleep. It doesn't bother me. But unlike some other person, I'm not trying to stigmatize them now. Unlike other people that live with, say, high blood glucose, high glucose level, or it's not easy for them. Yeah. They have special line of treatment for themselves, management for themselves.
And it could be expensive.
Very expensive.
Little or no support.
Very expensive. But we thank God for Almighty God for touching the heart of politicians, for agreeing to support the international community to provide free services in this environment. No. We thank God for that. Okay. So if somebody is saying the government has not done anything for him, the government has done a lot more for me. Okay. For providing me with that care that make me stay alive today. Yeah.
So still talking about the people living with HIV and the kind of support that they have you had any incidents where perhaps a member of your group comes to report that there've been some unfair treatment to them in their line of duty or business? Can you share a story if there's any?
A lot.
Just
I
tell
can
us
tell you
one,
so
maybe one
many.
striking one.
As I speak with you, somebody will be coming from Uromi
Okay.
to lodge a complaint. We've talked on phone, and I encourage her to come. I've gone to the SAC Center, Sexual Assault and Referral Center,
Okay.
to lodge this complaint. She was stigmatized. She sells, and even members of her own family, people in the street stigmatized her. Today, the business is down. Stigmatization here did not just mean that she was accusing you will get HIV. The person took it upon himself to clap in the street. That is crazy.
And very demeaning.
And it is continued by saying, go and call who you go call. She has called me now and jumped into the case. And there are so many other ones too that has to do with wife battering because she's living with HIV and today most of the marriages
they would think the partner got it through promiscuity and so much more. I mean, that's the first thing that any partner is going to think about.
Not knowing that also that it is possible you, the man, you are just in the window period. One, the possible reason why, as at that time that screen was on, you are still in the window period.
Difference in immunity?
Yes, or you are among the discordant couple. There are some people, it's only God knows how they were designed. They cannot be infected with this.
Please tell me more about it.
That's what called a discordant couple. We find a situation where two people are in the house. The two of them never...
They've been sexually active,
yes,
but one is positive and the other is negative.
Even before their screening, they've been together, have children together, but at a point one went to the facility, maybe during any of the childbearing, so maybe their first child, and found out that she was positive. They will request her to invite a spouse. On the spouse getting there, they screen the spouse and find out that it's negative.
And there's no scientific explanation for that.
For now, well, I'm not a scientist, but I know it did not just come by. It has to do with the person's body mototype.
But what you want to say is a God factor. Perhaps the person is so prayerful.
When I started
person fasts a lot.
When I started this session, I told you I don't believe in spirituality when it comes to HIV. It's a practical thing. So it's not a spiritual. Don't attach spirituality to it. I didn't say you shouldn't pray, but do the right thing first.
Okay.
If you are taking your medication, take it rightly. So for that set of persons, I have a lot of persons I work with. They are my coordinators in different locations. Their wife or husband are still negative for more than 10 years.
And they are not on medication.
They are not on medication.
So again, I'm eager to ask, if you find a situation like this, one of the partner is positive and the other is negative. Now, the one that is negative, do you make that negative partner to be on the prophylaxis medication?
No, they are never on prophylaxis. They are never.
Is that not risky? Perhaps that immunity could break down at some point and they become vulnerable.
This treatment, we have access to visit the facilities every 3 months or 6 months, as the case may be. That's why anytime you have an appointment to attend to a doctor, always go.
Okay.
And within this period to continuous, that's what we call, you submit blood sample for further analysis to see how you are doing.
Okay.
Even at a point, our livers and other sensitive organs we are being checked, but the funding for that now is gone now. We don't do that again. But I assure you, once you are using your ARV and you are using it well, once you are suppressed, I've been suppressed for more than 17 years.
Wow, that's a long time.
Yeah, a long time. And
17 years.
Yeah, and I still take my medication.
Now let's talk about the impact.
Okay.
Side effects.
Okay.
So what are some of the side effects? Because this is on a personal level now. It's not like what I'm reading off a leaflet of the medication. So what are some of the personal side effects you have experienced in this 17-year time?
HIV science, if you read it in the paper.
Yes. How
people are infected, how they live positively, how they live with the virus and all the management steps. In practical, there are two different things there.
Seriously?
Yeah.
So it means that scientifically there is still a lot that is yet to be discovered.
And what are the difference there? Suppose you talk to somebody, you say if you screen somebody, you place the person. Is it easy? Is it everybody that are ready to attend to that screening? So many people that have been tested and they were linked to care, they are in care. At a point, there's what we call drug fatigue. They got tired and say, look, I will
Of
not take
taking
this
that
again.
daily pill.
It's not easy, my guy. It's not easy. Because I want to stay alive and make my own impact to the development of this state and the country at life.
Wow.
I have to continue. So that is for that. Coming to other area of management, well, you need to eat well. Eating well doesn't mean you must go to Mr. Big. So there are little things around you can put together.
Eating well is not essentially eating expensive.
Expensive. Take more vegetables.
Which could be found around
easily. We just are proud. Because we are proud, we don't want to come down to our level. Those that say, sew your coat according to your size. These days, sew your cloth according to your color.
Fabric, yeah, what you have.
So, I have vegetable around me. My wife planted ugu, and even behind me, there is a plantation there.
No.
Water leaf grows in them. I go probably bring it out, you wash them well.
And you don't have to spend out of pocket on that.
Spend out of pocket for that. Then exercise. You must run distance to achieve that exercise. There are 2 short distance you can travel to.
Or just taking a walk.
Just walk. Let us feed that. Let sweat come out of you. Take plenty of water and personal hygiene. Personal and environmental hygiene. Most important. Because if you are hygienically okay, personally and within you and in your environment, this opportunistic infection. And do you know today, one of the highest killer of persons living with HIV today is TB.
Which is one of the opportunistic
infection, yes. And if somebody that is already living with HIV comes down with TB, will stop the HIV treatment.
And focus on TB.
Within months, the TB though is curable, but that is it. So, and if your environment is not clean and you don't apply some safety precaution, like if you're in a dense environment and somebody else is coughing, sneezing, try to use an handkerchief to close your face. You cannot be wearing face mask here and there. So those are some of the basic things. Then be happy. Be happy. But it pains me that when our people are in heroic care. In our case, we bought drugs, even in UBTH.
Oh.
But today, drugs are free for people, and somebody will use drug, and after a time, we just decide to say, look, I'm not going to use again. Especially when the person is already doing fine.
Doing well.
The only area I have issues with religion, though this Christian religion at a point, it's not an issue. Maybe I will just have a need to encourage them, beg them to support our people more. They've been supporting us, but they support them more. In the area of encouraging our persons to continue.
So you take their medication.
Because even now that I'm suppressed, I still use my medication.
Daily?
Daily. I've taken for this morning, 9 o'clock.
Wow.
But at that level, especially when marriage thing comes in and the person goes in there to want to marry somebody, you say you go and do your testing. And when he or she comes back, there are so many law-breaking action there. Come back with the result. The funny thing, they suggest the facility you go to. And that result is shared among themselves. They will only tell her this.
So that confidentiality policy is broken.
It's broken already. And that's where I'll be having issues with a lot of them. Like where I live in Sapele, we have serious issues sometimes, but we have to come in again, sit down, and we begin to sensitize them on the legal aspect of what they are doing. As a trained lab technician, you have no right to disclose anybody else. And besides, before you screen somebody, the person has to give you an informed consent.
Yeah.
You have to consent to that. Where are those documents pointing to that? Because they want to marry you.
I don't think there's anyone.
No documents. And that's where the state government is working on how we can really update our anti-stigma laws. Yes. To meet the current. Look at the fine. It's not much.
How much is it?
It's not much. At most, it's 500,000 for an individual and $1 million above. But that is not even enough.
Looking at the magnitude of the impact that can be made on the lives of people.
We are begging. We've done a lot of sensitization to some. That's why we normally invite religious leaders to. Last time I invited council representative, and some of these things we are talking about. So, and again, one other thing that is happening, some persons will just go to, maybe they go to church, one of those funny churches around, or a spiritualist around. After applying 1 or 2 substance, whatever prayer, and ask the person to go and check. They are very intelligent, some of those religious or traditional people. They know that because you told them that, you confided in them and told them that, look, you live with this virus, they will subject to ask you to go and redo a screen, knowing too well that you already be using your ARV for a very long time.
Oh.
By the time you return back, they say,
oh, sorry, the ARV is combined with the prayers, so to say, from them.
yes,
And then they then make the person go back for a repeat.
and believe that
the
because the virus is no longer, the prayer has worked.
Okay, and
Or
the person has been
the
healed
substance
or
the traditional man gave him or her
has worked.
Hence, they will stop care. And by the time they return back,
they become worse off.
So you can take whatever you want to take. You can subject yourself to any form of prayer, but take your ARV.
Okay. So let's come back to your family.
Yeah.
Your children growing up, realizing that their father has... So how did it happen? Because I know a child is born, a child grows up, then learns how to talk, starts going to school, and then gradually begin to get integrated into the family, knows everything about the family. So how does it happen for all of your children?
The first step to... We are still talking about disclosure here.
Okay.
They are aware.
All of them are aware?
They are aware.
Sorry, at what point, at what age did they become aware?
They grow to meet people that are already aware. Like the elders, they are aware.
Okay.
And the younger one will tell the elders, the elders will tell the younger ones. Though they may not tell them, look, daddy has this, or mommy has this.
Okay.
You know why we insist that if anybody is reactive and is linked to care, is taking medication, we expect the person's spouse, whether marriage or girlfriend or a boyfriend, to be aware. Somebody should be aware so that to remind you of your medication.
Oh, okay.
In this case,
not necessarily for somebody to police you, so to say.
In this case, it's children reminds us.
Oh, interesting.
So they are aware that have you taken your medicine?
Wow.
Let's go medicine.
Wow.
Though at that time they may not know what kind of me, but
exactly.
It's a practice that at about this XYZ time
I should be taking this.
So that is one. Like the ones that are grown that can't read and write and know what it is, they are aware.
Okay.
Yeah, they know what I do.
And how did they take it? Like, how did they receive the news and what was their reaction?
Firstly, it started with I was invited to EBS television session.
Okay.
To do a talk. There's this every year an International War AIDS Day.
Okay.
A World AIDS Day.
That's in December, I guess.
It's December 1st.
Okay.
And they saw me when I got to know, like,
what were you doing on TV? What do you have to do with AIDS?
My daughter said, Daddy. She was still growing up then. She was already 16, 17. Long time ago. So, that's where I work.
Okay. That's
well, she was the one that asked.
Okay.
From what you say you live with HIV. I said, yes, I live with HIV. So that I didn't tell you.
Oh, interesting. So she found out on TV, yes, literally.
So how do you feel? And besides, before now, too, most of the educative flyers and other things I bring home.
Oh, they've been going through it. They have access to all the information.
It's just on my shelf.
Oh, interesting.
She started this. She was the one that started supporting us, reminding us of our medication.
Oh, beautiful.
So then she said, okay, is that why you're taking that? I said, yes.
Yeah, started connecting all the dots.
Since then, well, she took it as today. Wow, I'm even planning on. I have an NGO.
Okay.
Osaka Garoba for Positive Living Foundation.
Okay.
And she's one of the directors.
Interesting.
So
people can get to meet her and talk to her some of these days, hopefully.
She's married and she's in Delta State.
Oh, interesting.
She do come around.
Okay. Maybe. Interesting.
Maybe as we continue, one of those days she will come around.
All right.
So everything's okay. They are all aware.
Okay.
My status, and they're happy with that.
No. So still on your children, have they had any experience where they are being discriminated against, because of your status? And perhaps people also alleging that, they might also be carriers of this virus. Have they shared any experience with you whatsoever?
I wouldn't know, because I have not had any experience of that. They know their father. They know I'm very confident of myself.
Exactly.
In anything I do. So you that is going to, even they will tell you that you that is going to talk about this on somebody, do you look more good than my father?
Exactly.
So it will be difficult. For people, it will be difficult. They may say it corner and be aside, but not in those children's presence. I know my children. They know the right response to give to you that you shun that. Okay. So that is it.
All right. So as we wrap up our conversation, what's your message out there to people who are going to watch this broadcast, about getting to know their HIV status, and for people who already know their HIV status and are not being proactive in terms of going to the right facility to get support? I want you to address them right now.
Well, I must tell you the honest truth, my viewers. It is good you know your HIV status than you don't know. If you know what to do immediately. And if you know on time, the possibility of you becoming virally suppressed is very quick and sure. But if you don't know, you might be lucky to bounce back. Because if you don't know, so many things will come up, and if you're not lucky, it might not return. That's what we preach. Go out there, go to any government facilities, go for a compulsory, a voluntary HIV screening. These days now, oral self-test kit has been introduced.
Oh, interesting.
Yes, you can be in the comfort. Go to any pharmacy.
But are these results reliable?
At that point, if you used it and it shows you are reactive, you have to still do a confirmatory test in the facility.
Okay.
So, but if you have access to any of the government hospitals in Benin City, and there are also accredited private hospitals too, and you just go do it. And let me assure you, we've done a lot of work. NEP1 Edo has done a lot of work to ensure that confidentiality of your information is sure. Yeah. So don't be afraid that any government staff or people who work in the hospital, even if you have a family member there, everybody have their businesses. They will not disclose your status. Your status can only be disclosed by you if you want to, because there is a law guiding that area of the management. You don't have right to disclose anybody's status. Outside that, do your screening. You are enrolled into care and you are good to go, and every other thing will follow. The English people say health is wealth, and
exactly.
If you are not medically strong, I don't know how you can continue that job you are running to.
That's true.
So as you can see from me, if you don't mind, I will leave my number behind, and you call me any time of the day.
Exactly.
So if you are ready,
his number will be displayed on your screen shortly after now, so you can reach out to him
any time of the day. If you perceive, I'm not a medical doctor, let us get that no, but over time, I wear the shoe, I know where it pinches.
And then you also have access to a lot of trainings and capacity building programs.
There is not you tell me about this science that I will not know, especially when I'm already a carrier.
For over 17 years.
So please, it's not a joke. It's not a fin. I'm not trying to trick you into things that is not real. If you Google where, you will find Osayi Friday State NEP1 coordinator on your phone.
So you can check that out on Google.
Yes, I work with Edo State SACAB, State Agency for the Control of AIDS. I work with them, and so many other, even the Ministry of Health and so many other line ministries on this. So thank you for listening, and God bless you.
Thank you very much, sir. I think at this point in time, I should have a handshake. Yeah, I really want to appreciate you and commend your efforts and your courage.
Anytime.
Thank you very much.
My doors are open.
All right. Thank you very much. This is how much you can take on today's episode. Do well to like, share, and subscribe, and comment down below what you think about this video and how we can continue to give you even greater content of this nature and many more. Until we see you on the next one, for now, we say thank you. And we'll see you on the next one. Bye-bye.